Welcome into To Your Health. You know, I've been a diabetic for probably about 20 years of my life right now, and two things that I have to have checked on a yearly basis, my eyes and my feet. And today I have with us two of the outstanding podiatrists in this area, Dr. Lashonda Kille and Dr. Brian Kille, Greenville Foot Care. That's the name of the organization, obviously greenvillefootcare.com, and you can get right to the website.
Mm-hmm.
That's an easy way to do it. Dr. Kille, Dr. Brian Kille, because I went into your office and with being a diabetic, I had a yearly inspection, and everything turned out on that inspection. But you said because you're diabetic, maybe you want to have another test run, because one of the big things that can cause a problem is circulation of blood into your extremities. So explain to me the procedure that I had done.
Well, to start with, peripheral arterial disease is when the arteries are blocked.
Okay.
Right? It's kind of like a pipe that's been clogged up.
Mm-hmm.
Okay, and it can lead to amputations and death of tissue. And so it's important that we look at that on a yearly basis. And we have a machine that's very non-invasive and very fast. And what we do is put some blood pressure cuffs at different areas, and in about 5 to 7 minutes, we get a readout of how your blood's flowing.
Mm-hmm.
And then we can decide if we need to send you off to vascular surgery for more aggressive studies.
Right.
And this test is covered by insurance. They don't have any problem with it. It's recommended by the Vascular Association for anybody over the age of 65, every diabetic that's 50 or older, and then other folks even younger who have either high cholesterol, high blood pressure, they have a smoking history. All of those are recommended by the Vascular Association to be done yearly. So
I had the procedure done. It was very simple. Like I say, you went in, you sat down, and then she put the cuffs on. And then I think probably within about 2 or 3 days, you called back to let me know what it was all about. And it turned out to be nice. Thank God. Thank God for that always.
Now, and yours was the more aggressive machine. The newest machine I will have the results before I ever walk in the room.
Oh.
So I will be able to, within a couple minutes, go over them with you on that day, give you a copy of them to take with you to your primary care doc, and you'll be all set.
Okay, so the less, it's kind of like taking a smaller test, and if it looks like everything, if you pass that, you don't have to go to the next step.
Correct.
Yeah.
Yeah, it's more of a screening. Mm-hmm. So it'll screen for something, and then if it picks up something, then we'll do the bigger test to sort of get more information.
Mm-hmm. And I think our viewers need to know that in order to have these different tests done, or even to visit you as a podiatrist, we don't have to, you don't have to go through your primary care doctor.
You do not.
You can call directly, and then you can just schedule the appointment to come in and get the different things done. Because a lot of times, when you get into all this referral stuff, especially in this day and age, it seems like it takes forever.
It does.
To be able to get anything done, and obviously you want to do the right thing. So if doing this procedure, if there seems to be problems, then you get referred to a vascular surgeon.
Yes.
Or to a cardiologist. You do go directly to the surgeon?
Directly to the vascular surgeon.
Okay.
And there's a few that we work with in Montgomery that we regularly refer to.
Okay.
We've had a great history with these physicians, and they always give us great feedback. And when we see the patients back, you know, they say they had a great experience and they're doing much better. So we always refer you to someone that we know and trust.
Okay. Because like I say, in the case, I had I'm an 18-year survivor of 6 bypasses on my vascular system, wow. Okay? But I initially started with my cardiologist, who then said, he did the heart cath. He said, I can't do anything for you. You need to go to part 2, which is the surgeon.
Right.
So basically, once you've done the work you do, it's almost like when they did a heart cath, and they found out that there's some problems, and then you can go directly to a vascular surgeon from there.
Exactly. Yeah.
Okay. So basically then you're referring that person to the vascular surgeon. They don't have to go back to square one with their primary care doctor.
No.
So from our viewers' perspective, what they need to be able to do is do some self-examination of yourself. Just like you mentioned, key things, nails, the loss of hair, and just things that are a little bit unusual about your skin.
Yeah.
right? And if they do that, then basically they can say, maybe I've got a problem, but if nothing else, when they come to see you, you're going to do that. And then if it requires the peripheral examination, you're ready for that.
I am.
Good. Well, thank you guys so much. Always a pleasure to have you here.
Same.
And just remember this, that it's Greenville Foot Care, and they can take care of your feet, and they can examine you, and of course, if need be, they can even do surgery. So we'll be right back right after this.